I'm Adrienne and this is CBC Edmonton News. The Alberta government has unveiled what it calls an aggressive plan to tackle the growing opioid crisis. First of all, opioid use is being declared a public health crisis, which acknowledges it is a very big public health problem. But the government is stopping short of declaring it a health emergency, as BC has done, saying they already have the needed power and authority to deal with the crisis. A 14-member commission is also being set up called the Opioid Emergency Response Commission. It will be chaired by Dr. Karen Grimsrud, the Alberta Public Officer of Health, law enforcement officials, and those who work on the front lines of the problem. It will make recommendations to the minister on how to corral and coordinate resources and fight opioid addiction. Its budget is $30 million, and it's expected to be in place by June. Fentanyl killed 113 people in Alberta in the first 3 months of this year and 363 people in 2016.
I think our aim at this point is to keep people alive. We know that the numbers are devastating. We had 363 deaths in 2016 due to apparent fentanyl-related overdoses, and another 113 deaths in the first 3 months of this year. But these aren't statistics. They are people dying every day in Alberta, and these are Albertans from all walks of life are at risk for overdoses, whether it be from recreational use or chronic opioid use, or a misuse of prescription medications. This work comes with a great responsibility, and I'm pleased with the trust you placed in me and other commission members to strive forward with this ambitious and aggressive plan to save lives.
Joining us now with his take on today's opioid announcement is Dr. Hakique Virani. He's an addiction medicine and public health specialist at the University of Alberta. Good evening, Dr. Virani.
Hi.
So what do you think of the government's new opioid action plan?
I think there's a few impressive elements. I mean, the one that strikes out, that strikes the most is that they've expanded the leadership group of people who are involved in the response, finally to include some people with content expertise on this area in public health and in substance use.
Yeah, meaning on the front lines.
From the front line, but also from the research community. The co-chair, Dr. Hakique, is very well aware of the crisis, knows the epidemiology well, and knows why what works in the literature. She's also very skilled at engaging people who use substances in coming up with realistic solutions to problems that they face, and that's been missing from the action plan to this point. Also including people with lived experience, who have had troubles with substances before, have lost family members, who live and work on reserve, and who work in harm reduction programs. I mean, I think those are really important perspectives, not only so that we can hear what the pressures are, but also what would make a solution actually practicable, realistic.
Now, the government declared a health crisis, but not an emergency, and you, along with many others, have called for that. So what do you think of that move?
Yeah, I mean, there's a bit of obfuscation around why this isn't an emergency or why our legislation somehow is different from British Columbia's legislation. And I think the bottom line is there are certain provisions in the Public Health Act that we would like to use, and certain powers that we would like to use to respond quickly. One of those powers is to allocate resources, which, to their credit, they've done. And that's a really impressive part of this plan, too. They've injected a large amount of resources into solving this problem for 2017, and that's been critical. We've had a shortage of resources to do that. But there's some other things that need to be done here, too, in terms of direction. And one of them is that the minister or the chief medical officer of health or whomever should be able to direct health professionals to work on this problem in a certain way very, very quickly.
Right.
One of the things that they've talked about for a long time is expanding access to treatment for evidence-based addiction treatments with medications like methadone and Suboxone. And we know that there are tens of thousands of people who may benefit from that treatment. And over 3 years, we've only seen 2,300 extra people get access to it. Partially because the way we deliver it is during bankers' hours in clinics that are only open Monday to Friday. And if you're struggling with an addiction and also trying to live the rest of your life, that's a really difficult thing to get benefit from. We'd like to see 24/7 treatment facilities, 7 days a week for anybody who has an aha moment and says, I'm scared I'm going to die tomorrow the next time I use. Yeah. We'd like to be there for them. Public health emergencies legislation would allow us to take physicians or health professionals from one area and put them in another rapidly to do that sort of thing. Now, can you do that without public health emergency declarations? Sure. The question is whether or not they will. and I hope that they do.
Yeah, so clearly this goes a ways, but not quite far enough for you.
Well, it could. I guess, we're several years into this problem. And the longer that it goes, the worse that it gets. And the more difficult it is to rectify the situation. The drug supply is becoming more toxic. People's addictions are progressing to where there's more social dysfunction, where there's more family dysfunction, where they've lost their jobs and their children and such. And so on an individual level and on a population level, we don't have time to wait. And so, establishing a committee that's allowed to give some recommendations is good. Giving them power to act quickly and resources to act today is what we'd like to see. And I hope something like that comes out of the announcement today.
Now, I know you don't have a crystal ball, but with everything that's in play at the moment, do you feel like this crisis is going to get worse before it gets better, or are we going to see more positive results now?
Yeah, Dr. Hakique said something that was very wise in her remarks today, and that is that, that we've waited this long makes this a very difficult problem for us to manage, and expect that we're going to face challenges going forward. Yeah. And also expect that the moves that we take must be extremely bold. Some of them might be a bit unpopular, but they have to happen now, and they must be things that we've not done before. And one of the considerations is that as this drug market becomes more toxic, the need for innovative harm reduction programs increases, not just supervised consumption services, but also things like injectable opioid treatments for people who have really progressed addiction disorder, and where giving them that option is safer than allowing them to continue to use on the street things that will very likely kill them today or tomorrow.
Right.
And so I was heartened to see that kind of bold language from the co-chair of the commission, and I hope we see action on those. Not just options on the table, but things on the front line that patients can get benefit from.
Yeah, well, we'll all be watching this very closely. Thank you so much for your thoughts today.
It's my pleasure.
Dr. Hakique Virani is an addiction medicine and public health specialist at the University of Alberta.